Hey, Professor, I hope you're doing good. Uh, as you know, I'm Joey Snell, and welcome to my clinical case study on respiration. So, before we get started, I do want to let you know I'm not reading from anything. I do have my notes above here just to keep on track to answer the questions for the video portion. So, you see me looking up and making sure I'm looking at anything. I'm not reading. I'm just looking at my notes to make sure that I'm following along with the presentation questions. So, before we get started, I want to do a little overview on Miss Smith, who is our patient. So, as you know, Miss Smith, she's 68 years old, and she has been living with COPD for the last 10 years, and she has a history of long-term smoking for 40 years. Over the past year, she's been having difficulty breathing, coughing, wheezing, overall just feeling pretty weak and winded. And this has, further affected her speech, causing it to be weak and breathy and just really overworked. And so, she's looking for some help from us as SLPs, and with her concern, and her family's concern, with trying to maintain her communication and make sure that she has a pretty good social life. And so that's where we are, and that's her overview. So, with that said, when we look at her medical history, so with everything that we have said, and the symptoms described, and everything, the cause of her chronic respiratory issues, so her COPD, the cause of that, she's definitely having that because of her 40 years of long-term smoking. I mean, this is what COPD is. So COPD, even before doing this project, I knew about COPD, but I learned even more so about COPD. Not a little fun fact, but a lot of older people have it, and my Nana has it too, and she's around that age, and she has had experience smoking, so she does have COPD. So what it is, it's a ongoing lung condition that is caused by having damage to the lungs. So what is causing that damage? So if we look at the anatomical and the physiological changes, what's happening to her healthy lungs over the years of long-term use of smoking, the damage is causing her lungs to swell and be inflamed, or it will be irritated, which is causing inflammation. So what does that mean? So they're getting tight airways, everything's inflamed, everything's just not good, not healthy. And so when she's breathing in and breathing out, it's not normally working well. It's not, flowing as it should because of the limitations of that air coming in and out of the lungs. And so what's causing that is her smoking. You can see this by the CDC. The COPD is most often caused by long-term exposure to irritating smoke, chemicals, fumes, dust, anything. But the most common that we see is cigarette smoke, because most people smoke. And so those changes that are happening to her lungs, from going to healthy lungs to not so healthy lungs by a long period of time, by that irritation, is causing her lungs to not get the proper airflow, which is causing her to have breathing problems, and which is also causing her to affect her speech, because we need that airflow to do everything: live, speak, even eat. It is also, I know they talked about they want to make sure that her communication is good, but also a thing that can affect it, and I'll have it in my written portion too, is she can have dysphagia. She can have trouble. She can have trouble eating and swallowing because of those muscles that are being strained from not getting the airflow that it needs. So, with that said, yes. So, what is the typical speech that and voice characteristics that you might find from a person that has COPD? Well, it's a lot like what Miss Smith has. It's breathy. Oh, sorry, it's breathy. It's weak. It's labored. It's working overtime. It's not getting the airflow it needs. So it can also be, her vocal cords are working overtime, not getting that airflow, that support that they need to do to hit each other. So she's getting, you know, fatigue, from that prolonged speaking and everything. So she's just getting really tired because she doesn't have that breath support. Um, and so, she can have trouble catching her breath too when she's doing any activities, any physical activities. And, she can have wheezing and whistling sounds in her lungs because they're not getting the proper air. So, if she talks or something, she'd be long winded and talk really slow and wheeze and try to get that air out. And so, and that can also cause for the inflammation and the swelling. You have a pretty nasty cough with that too, and that's what she has. And it's also caused by having mucus in the lungs because of it not being healthy and causing those irritations. And so, how do these symptoms, affect a person's ability to communicate efficiently, and what impacts they might have on the quality of life? Well, when you can't breathe, you can't really do most things, and so you need to breathe. So her difficulty breathing can cause her to do a lot of activities. So it's also going to affect her social life, and she can't do things that she enjoys, and so it's a serious medical condition, and she needs to make sure that she takes care of it. And if we don't get her the help and therapy she needs, she can develop a lot of anxiety from it and not self-confidence, and that could also lead into maybe some personal depression and stuff. So not being able to breathe is a big thing, because if you can't speak, then you're not going to want to speak anymore. And she has a voice and she wants to be heard. And like I said, one thing that it doesn't talk about is dysphagia, where trouble swallowing, because those muscles are working overtime in her throat and everything. So they're making the muscles weak, and so like she can have irritation and shortness of breath and stuff like that. So so before we can give Miss Smith any of the help that she needs, we need to consider her cultural background and what may influence her health decisions, her behaviors, and any other approach that we may help her with any screenings or anything like that. So when looking at the patient overview, there wasn't much said about any of her cultural background. She has COPD, and that is most common in women, and being over a certain age. So she is over that certain age, so she's most common to have COPD, which she has. Regardless of it not showing any cultural, behaviors or backgrounds, we still want to keep that in mind, regardless if it wasn't even said in the overview. So, we have to look at where she lives, because people in lower incomes and social economically disadvantaged communities are at higher risk for developing COPD, due to the environment they live in. They could have, poor neighborhood that's exposed to any like fumes or industrial fumes or smoke, or it might be exposure to tobacco, and stuff like that. So we also need to look at and make sure that she's in a place where she can access her important health care, and she can get these resources to be more educated on it and get those information. So with that said, so what kind of techniques that I would give to her, tools to consider for her? I think the first thing, try to keep her educated on it and let her know that COPD, it's not reversible, it's not curable, but you can prevent it from getting worse. And she has that years of smoking, and I know it's going to be a tough ride to quit, but we want to make sure that she can quit, because then she can breathe better, have that, and it will cause not that inflammation in her lungs anymore. So we're going to try to do that. And we're going to give her the therapy. We're going to test her. We're going to see her capabilities, her lungs, give some breathing exercises, and the most important thing, we got to make sure that even if she's in an area where she can't get the help that she needs, we need to make sure that we can at least provide her for the help that she can have, and take that at home and do what she needs to do at home to help her breathe and get her life the way she wants it again, to be again, And so that's how I would help her. And, we got to make sure too, for forgot to mention, we got to make sure that, you know, whatever her religious views are, or how that can affect her decision in doing any screenings and stuff. We want to make sure at the end of the day she's comfortable with doing everything. She's well educated on the manners and knows how to help herself while we help her too. So I think that is all the questions I had to answer for this part. And so I hope I did a good job, and I want to say thank you for taking your time and watching my video. So thank you, and I will see you on the written portion.